President Biden held a press conference today, and there he called on business owners to assist him in getting more Americans vaccinated by offering employees paid leave to get their shots in time to recover from any side effects. In return, the White House is offering a tax credit to businesses and nonprofit organizations with less than 500 employees.
So again, every employee should get paid leave to get a shot. And businesses should know that they can provide it without a hit to their bottom line. There's no excuse for not getting it done. To celebrate our independence from this virus on July 4th, with family and friends in small groups, we still have more to do in the months of May and June.
President Biden is celebrating reaching his goal of 200 million shots in arms by his 100th day in office. Joining me now is a professor of medicine and oncology at Johns Hopkins University School of Medicine. She also specializes in the treatment of patients with viruses such as hepatitis and HIV. Dr. Andrea Cox. Welcome, Dr. Cox.
Thanks so much for having me.
Nice to have you. All right, we've heard from the president that he is excited about meeting his goal of vaccinating 200 million Americans by his 100th day in office. What exactly does this say in terms of the medical community and in terms of what is happening with the number of cases we're seeing in this country?
This is a really exciting and important step forward. We've really vaccinated large numbers of people who are at highest risk of severe disease. And as a result, we're actually seeing rates of hospitalization in elderly people, who were the people who were vaccinated first, as well as healthcare workers. We're seeing rates of hospitalization and death declining in older patients. So this is really important and big news.
Now, of course, we keep hearing in the news, we've reported it here on BNC, about the Johnson & Johnson vaccine. We know that people they have concerns about these vaccines, and then when you hear things like the pause of the J&J vaccine, how exactly do you help people work through their fear and anxiety, and how do you think it will impact the administration's efforts to continue this momentum?
I think it's important to realize that this pause is prompted by ongoing observations with all the vaccines that are given. So 2 of the vaccines that are in use have not had any concerning signals at all. And the Johnson & Johnson vaccine, in more than 7 million doses given, has had 6 people who've had very serious reactions. So this needs to be taken seriously and it needs to be evaluated. But I think this shows that we are watching carefully and making sure that the vaccines being given are safe. And also importantly, the side effects that we're seeing, there are treatments, and so we're trying to learn if those treatments can be given quickly and the vaccine can be safely given to everyone. And while that's being determined, no vaccines from Johnson & Johnson are being given in the United States.
And so when people do take the vaccines, do they still have to wear masks or not? Because there seems to be confusion, because you're finding people now who say, well, I don't need to wear a mask because I had the shot. How exactly does that work?
So the vaccines are designed to really stop the spread of infection and to prevent severe disease. And they are doing a very good job of that, but they're not 100% effective at preventing all disease or reducing all spread. So while they dramatically decrease the rate of spread, and they essentially 100% prevent serious infection requiring hospitalization and death, people can still have the sniffles or feel a little under the weather after vaccination, and it's still possible to spread the infection to others, although the chances of that are much less. So we wear masks to keep those around us safe, in case the people with whom you're interacting would be at serious risk of infection. So even though the chances of sharing the infection are small, if the person's going to do very badly with that infection with COVID, we don't want to risk even a small chance of spreading it to them.
And you are at Johns Hopkins University, which of course has been at the forefront of putting out data about the cases and so forth. People are still trying to understand, when will this end? And I know that is a question that's, you know, a $1 million question, but people have been going through this for a year now, more than a year. and they're just hearing numbers and cases and data. But at the end of the day, I mean, are we ever going to get rid of this? And if so, how long and what will it take? And are we still hearing cases of hospitals that are overburdened? Are we still facing the same struggles early on? Or are we making any progress? How can you help us understand the exact status of what's really happening right now?
We are seeing much less serious disease. So while some people are still coming to the hospital, far fewer Americans are dying from this infection. And I think it's important to think of it this way. I think this is a good analogy. If you're trying to prevent a forest fire and only 1 out of every 10 trees can burn, it's going to be very hard to prevent the spread of a forest fire. But if 9 out of every 10 trees can't burn, then that one tree that's at risk can be protected by the trees that surround it. So those of us who can get vaccinated don't just protect ourselves, but we protect the people who are not going to be safe after vaccination, people who are on chemotherapy or have other immune suppressing medications. So I think there is an end in sight. And the closer we get to that 8 or 9 of every 10 people vaccinated, which is why President Biden's saying, if you're over 16, go get your shots. We as a community can protect the people who will not respond as well to vaccination. And it's really critical that we all pitch in. And then I think we will bring an end to this. And I too, like the president, am really hoping to celebrate not just independence on the 4th of July, but independence from this virus.
Well, we are going to leave this on a positive note. We are out of time, Dr. Cox. I really liked your analogy about the trees in the forest. That really makes a lot of sense and helps us put it into perspective. Thank you so much for joining us here on BNC.
Thank you so much for having me.